Hi everyone, Mandy here again. If you are new to this channel and you have not seen my introduction video, I have been teaching yoga since 2003. I personally have severe scoliosis and I have been teaching yoga for scoliosis for about the last 8 years. Today I thought I would jump on and talk about the difference between normal yoga and yoga for scoliosis, and whether or not normal yoga is a good idea for people who have scoliosis. So let's primarily focus on spinal movements, since scoliosis is primarily a spinal situation. I say primarily because it truly does have a ripple effect throughout the whole body. Shoulders, hips, knees, ankles, feet, you name it, are involved with scoliosis, but it's primarily a spine situation. So in a regular yoga class, we tend to do something called 7 movements of the spine, or sometimes you'll hear people say 6 movements of the spine. So we have forward flexion, rounding through our back. We have extension, number 2, that's our back bends. We have twisting, that's actually 3 and 4, so twisting in one direction, and then twisting in the other direction. And then we have lateral bending or side bending. And again, this counts as 2 because you can go into opposite directions here. So this is the 6 movements of the spine. There's also a 7th movement, which is axial extension, which really just means sort of getting longer and taller up through your spine. So I bet if you've been to a regular yoga class, you have done plenty of twisting and side bending, back bending, forward folding, maybe some axial extension, hard to say. Okay, so let's talk now about a scoliosis spine. And we always need to remember that scoliosis is really 3-dimensional. So we often think about scoliosis as just being the sideways shift of the spine. So basically we have a lateral bend in the spine already. Depending on your curve pattern, that's going to be in a different place. We also need to remember, though, that scoliosis also involves rotation. So when our spine shifts off to the side, the spine also rotates in that direction. The front of the spine comes towards that curved side. So if you have an S curve, we basically have our spine sort of being wrung out in 2 opposite directions. And this is how, when maybe you've gone to a doctor's office or in the school, a nurse has had you round forward to look at your back and decide if you have scoliosis. The reason they're having you round forward is because this rotation of the spine causes a prominence on the back. Sometimes we call that a rib hump if it's in the thoracic spine. So our spine is twisted, it's shifted sideways, and then we can also have a little bit of some decompensation here. So ideally my head's going to stack up right above my pubic bone, but sometimes there's a little bit of a whole sideways lean that happens in people's upper bodies. We can also have our discs affected by scoliosis. So on our concave side, things tend to be a little bit more compressed, and on the curved side, discs tend to have a little bit more space. So we have uneven wear on our spinal discs, and eventually we end up with a greater chance of having degenerative disc disease as well. So keeping all of that in mind, if we think about a traditional yoga class, let's see which of those movements are good for our body. So we had our twisting side to side. So remember, if my spine is already twisted, so let's say I have a right thoracic curve, my right thoracic ribs are going to be brought back a little further with that curve. So if I twist to the right in my yoga class, I'm really just exaggerating the pattern that's already there. Not necessarily the greatest thing to do long term. If I twist to the left in my thoracic spine, that might be helpful for me because I'm bringing those thoracic ribs that are back a little closer to neutral. So it's not great necessarily to do the same thing on both sides. Let's look at side bending. So if I have, again, a right thoracic curve, That means I have a concavity to the left. You can see the spine already looks like it's doing a little side bend here. So let's say I side bend even more. Is that helping my pattern? Yeah, probably not. It's bringing me into that pattern that I'm already in. It's possible that I could side bend to the other side and limit that to the thoracic area, and that might be okay. It might give the thoracic concavity a little bit of space there. Let's talk about forward flexion, rounding forward through the spine. So I mentioned the Adams forward bend test that happens in the doctor's office or the nurse's office, and that they have you round forward so they can see that prominence. The thing about rounding forward through your spine is that it actually increases the rotation and it makes that prominence more visible. So forward flexion through the spine isn't a great thing to do time and time again with scoliosis. How about back bending? Arching back. This is something you're going to hear a little controversy about. Some people say not to do it and others say that it's okay. There's been some recent research that actually showed that back bending or back extension can help reduce the curvature, or not the curvature, the rotation in your scoliosis spine. So that might be all right. And then our last one was axial extension, elongation. And this one is actually fantastic. That's one of our number one principles that we work with yoga for scoliosis, is to find that elongation. So, again, coming back to normal yoga versus yoga for scoliosis. Normal yoga, we tend to do the same thing on both sides of our body. As teachers, we tend to teach left and right. Scoliosis yoga, we tend to do the different things on our two sides because our two sides aren't the same. One side has a curve, one side has a concavity. So the two sides are different. We do different actions and different movements on our two sides. And rather than teaching left and right, I tend to teach curve side versus concave side. So there's definitely differences in how classes are taught when they have scoliosis at the front of the teaching. This is a conversation I have with a lot of people. They come to me and they say, well, I don't need a scoliosis class, I just need a gentle yoga class, or I need a beginner yoga class. And that's fine. I always explain to them why we do things differently in yoga for scoliosis. And I will say it's a little bit of a tricky question to answer, whether regular yoga is okay for people with scoliosis or not. Some people can do all of those typical movements and be pain-free. I did all of those movements pain-free for a couple of decades, and then I was no longer pain-free. And then I had to change my movement and become more aware of my scoliosis. So for me personally, I wish I had paid attention a little earlier on in life and really started to work with my spine instead of ignoring it. I do think it's an individual choice, however. I wish we all had sort of a magic glass globe where we could see the future and we could tell what the future of our spines were. You know, with scoliosis, we never know if our curve is going to progress. It depends a little bit on how we're moving our body. Depends on our age. It depends on our diet and our health. It depends on how big our curve is to begin with. So bigger curves tend to progress a little faster than smaller curves. So it is an individual choice, but I would definitely encourage people, based on my own experience, to learn as much as you can about your curve pattern and to start working with it. You can actually help stabilize your spine and lessen the chance of progression when you start to work with your curve pattern. I actually did reduce my curvature a little bit over the course of a couple of years of yoga for scoliosis. And I most certainly 100% have better posture now that I work with my curve. And I see clients every day that also have posture improvement when they start to work with their curves. If you have questions, let me know.